How to be more patient with mindfulness. Have you ever wondered how mindfulness can help you become more patient, especially if you are dealing with anxiety or post-traumatic stress disorder? Mindfulness is all about paying attention to the present moment without judgment. It can be a powerful tool for those managing PTSD and anxiety. Let's explore how mindfulness can help you cultivate patience. First, let's define patience. It's the ability to tolerate delays or discomfort without becoming overly upset. For individuals with PTSD, symptoms like heightened anxiety and emotional reactivity can make patience feel out of reach. Mindfulness helps by allowing you to observe your thoughts and feelings without immediately reacting. This creates a space between what happens and how you respond, making it easier to choose a thoughtful response instead of an impulsive one. So, how does mindfulness actually cultivate patience? It encourages you to notice your thoughts and feelings as they arise, but not to get caught up in them. This practice, known as non-judgmental awareness, helps you accept difficult emotions and sensations. Over time, this can build your patience and emotional resilience. There are several practical mindfulness techniques that can help you develop patience, especially if you are managing PTSD. One effective method is grounding techniques. These help anchor you in the present moment and reduce the power of intrusive thoughts. For example, try focusing on 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This simple exercise can interrupt anxiety cycles and help you regain control. Another technique is deep breathing. Slow, controlled breathing calms your nervous system and reduces anxiety. Inhale deeply through your nose, hold for a few seconds, and then exhale slowly through your mouth. This practice can help you stay present and patient, even in stressful situations. You might also try a body scan. This involves focusing your attention on different parts of your body and noticing sensations without judgment. Start from your toes and move up to your head. This practice can ground you and reduce physical tension, making it easier to remain patient. Mindful observation is another helpful technique. Spend a few moments observing your surroundings or an object in detail. Notice its colors, shapes, and textures. This helps shift your focus away from distressing thoughts and back to the present. For those with PTSD, traditional mindfulness practices may sometimes trigger distress. Trauma-informed mindfulness modifies these practices to prioritize safety and self-regulation. This might include focusing on external objects or sounds, or engaging in gentle movement with present-moment awareness. Regular mindfulness practice can improve your overall mental well-being and help manage symptoms of PTSD and anxiety. It fosters a sense of calm and control, making it easier to approach challenging situations with patience. Mindfulness also helps reduce avoidance behaviors and negative self-judgment, which are common for people with PTSD. However, while mindfulness can be a powerful tool for building patience, it is not a substitute for professional medical care. Some individuals may find certain mindfulness practices triggering, especially those that involve focusing on the body or past experiences. It is important to practice self-compassion and seek guidance from a qualified mental health professional if needed. In summary, mindfulness offers practical strategies for developing patience, especially for those managing PTSD and anxiety. By practicing grounding, deep breathing, body scans, and mindful observation, with adaptations for trauma sensitivity, you can cultivate greater patience and emotional resilience. Always remember to consult with a healthcare provider to ensure mindfulness practices are safe and appropriate for your individual needs.